If you followed me up on my last video, you remember that I handled the female reproductive system, and today I'll be handling the diseases that has to do with the female reproductive system. Like we said on our previous video, we said that the human reproductive system has to deal with the act of producing egg cells, protecting the fetus until birth, and nourishing them. While in the female reproductive system, it has to deal with the production of semen and deposition of semen. We also said around summary of how this process occurs through intercourse, whereby the male has to deposit the semen which contains sperm into the female cervix, and this has to swim down to the uterus over to the fallopian tube and gets to the ampulla where it fertilizes and comes back down to the uterus, and implantation occurs, which we said this is the process of pregnancy. This is the place where pregnancy starts. Now, if you remember when I said the uterine, the uterus, sorry, don't mind me about my diagram. I'm not a good drawer. I don't know how to draw, but this is similar to what it looks like in the human body system. Here we get the cervix, the vagina, and we said that the introduction of sperm into the female cervix has to swim in from here, moving over to the uterus, which is the womb where the implantation of the baby grows, and it drives it or swings towards the fallopian tube over to the ampulla where the ovaries from the egg cells come out and fertilize. And after fertilizing at the ampulla, it swims back to the to the fallopian tube over to the uterus, and here it implants or attaches to the uterine wall or endometrium wall. And this is where we say that pregnancy or gestational level occurs or starts. So today we're going to be handling the diseases of the human reproductive system. We are going to start with the female diseases of the human reproductive system, and my next video I'll be handling on the male diseases that have to do with the male reproductive system. Now, diseases of the female reproductive system. The first one we're going to be handling will say the endometriosis. They say that the endometriosis is a problem affecting a woman's uterus. And when we mean the uterus, we simply mean the woman's womb. This is where the baby grows, or where the baby stays in the womb until birth. It is when the kind of tissue that normally lines the uterus grows somewhere else. It can grow on the ovaries, behind the uterus, on the bowels, or on the bladder. It very grows on the other parts of the body. This misplaced tissue can cause pain, infertility, and very heavy periods. Now, like I said, first of all, this is our female reproductive system. Don't mind me with my diagram. So, this is what we mean by endometriosis, when abnormal tissue cells leaves from the normal endometrium lining and grows over to other parts of the pelvic region. It is said that these tissues they rarely grow on other parts of the body or other organs of the body. They mostly grow around the pelvic regions. So when you experience cramps, abdominal pains on your stomach, your lower thighs, for the women, when you experience such pains, it's advised you should go to the hospital and seek for medical checkup. Then, if you're having serious bleeding, especially bleeding between periods or after periods, like some people will tell you they experience heavy flow. Please, sometimes heavy flows doesn't mean that you actually experience heavy flow. Some of these things can actually be a sign of you having endometriosis. So when you have this kind of things, you're asked to go for medical checkups, follow up, go for culture tests, go for other examinations to know if you're actually in if you're actually safe, or if you actually have these issues, or it can also help you for early detection and early treatment of this. Now, some of the side effects of this disease, endometriosis, is that it can cause infertility. Yes, infertility. Some women out there, you think because you've not actually delivered before or you've not actually gotten married, you think you can't actually have problems of infertility. That in this endometriosis, some women don't actually experience some symptoms. Yes, there are some reproductive diseases that you don't even know their signs and symptoms. You feel normal, or you might even be feeling some abnormal health issues, and you think it's not related to that. So the best way to prevent such issues is for you to be going for medical checkups. You should go for culture tests. You should also check yourselves when you feel uncomfortable, abnormal things happening to you. You should think and ask for a medical advice. It also helps in early detection and fast treatment of such illnesses. Now we move over to the second one, the uterine fibroid. Now, the uterine fibroid mostly are not non-cancerous. Yeah, non-cancerous, it means that you can actually have fibroid and after treatment, you're okay. You don't have to go for chemotherapies, you don't have to go for a whole lot of physiotherapy, exercises, and all those stuff. You just have to go for your surgery and this fibroid is gone. So here it says that fibroids are made of muscle cells and other tissues that grow in and around the walls of the uterus or womb. The causes of fibroid is unknown. Yes, this cause of fibroid is unknown. But we have risk factors that may include being overweight. Please, another problem or risk factor to most health challenges out there is when you are overweight. So the signs and symptoms of this uterine fibroid is heavy or painful period or bleeding between periods, feeling full in the lower abdomen, urinating often, painful, painful sex or pain during sex, lower back pain, reproductive problems such as infertility, multiple miscarriages, or early labor. Now, if you, from what I will be lecturing you guys on today, you will notice that most of these reproductive health issues have most similar symptoms. You can actually go for medical checkups. You ask for your families, you tell them about your problem. Whenever you notice an abnormality from your normal flora in your system, you ask or consult for help. You go for checkups, you run some tests, culture tests, pap smear test, and other rest of the tests for you to be able to detect if there is anything wrong with your system. This also helps to prevent miscarriages during pregnancy. This helps to prevent infertility. It also helps to control or treat early detection of illnesses at the early stages. So some of the signs and symptoms of this includes heavy or painful periods or bleeding between periods. Yeah, like I also said, cramps. There are all termed as painful menstruation. I'm having painful menstruation. I experience painful menstruation. It is telling us that most of the painful menstruations we have out there are not actually painful menstruations. Some of them can actually be signs or symptoms of some health reproductive diseases. So when you have abnormal painful menstruation, or you feel that you're having too much or severe bleeding during your period or even after your period, it's advised to go for medical checkups. Then, in terms of pain during sex, some women experience pain during sex. Yeah, it can also mean because your body is not secreting enough fluid for you to lubricate the intercourse process going on. But at the same time, there are some women out there that even after the body is being able to secrete these cells, they still lack, they still experience this painful sexual intercourse, or some people their body have even lost the ability to produce this fluid that helps in sex, that aids in sexual intercourse. So it's advised that if you know you always experience painful sexual, if you know you always experience painful sexual intercourse, it's advised that you go for medical checkups and know if there is any problem in related to signs and symptoms of some health diseases. You should handle them on time and prevent them from escalating to a different thing altogether. So we'll go over to the third diseases of the female reproductive system, the gynecological cancer. Now, the gynecological cancer, this is a cancer that starts in a woman's reproductive organ and it begins in different places within a woman's pelvis, which is the area between the stomach and in between the hip bone. Now, when we talk about the pelvic region, it simply means the area between your stomach and your hip, the hip bone, like here. For example, we have the human the human reproductive system like this. Sorry, I can't draw. Pardon my drawings. So let's say that here and below this is called the pelvic region. This is where you find this whole diagram. It's found in between here. It's called the pelvic region. The place between the hip, below this is the abdomen, and this is the hip. So the place between the abdomen and the hip, it's always below the abdomen, like from the lower abdomen down to the hip bone is called the pelvic region. So here, when you experience pains down this, when you experience pains around these areas, abdominal pain, abnormal pain, any kind of pain, it's said you should go for a medical checkup. You might actually be experiencing gynecological cancer. So we have five main gynecological cancers women should be aware of out there. We have cervical cancer, and this is a cancer that begins in the cervix, which is the lower narrow end of the uterus. Like I said, this is the cervix. So we say that we have cervical cancer, and it's the cancer that starts from here. Cancer that starts from the cervical region of the human body system. At the vulva, the outer part of the female genitalia. Here is the opening of the vagina, the vulva. So when we've talked about these gynecological cancers, and we've seen that all these gynecological cancers can actually lead to infertility, miscarriages, and a whole lot of reproductive health challenges like bleeding and um, other health challenges too. Then we also move over to the fourth reproductive, fourth female reproductive disease, which is the HIV and AIDS. Yeah, HIV and AIDS. HIV affects specific cells of the human system, the CD4 cells, and over time it destroys so many of these cells that they cannot fight off infection anymore. When HIV stays in the body for a very long time without medical treatment, proper treatment, it's say that it destroys the body system, whereby preventing the immune system from being able to fight off infections coming into the body. Breastfeeding. This is a chronic bladder condition resulting in recurring discomfort or pain in the bladder or surrounding pelvic region. People with this interstitial cystitis usually have inflamed or irritated bladder walls that can cause scarring or stiffening of the bladder. This disease can affect anyone, however, it's most common in women than men. The symptoms include abdominal or pelvic mild discomfort, frequent urinating, a feeling of urgency to urinate, feeling of abdominal or pelvic pressure. This happens when a woman's ovaries or adrenal gland produce more male hormones than normal. One result is that cysts. One result is that cysts develop on the ovaries. And what would we mean by cyst? Fluid-filled sacs. So when women who are obese, it is said that women who are obese are more likely to have this polycystic ovary syndrome. Polycystic ovary syndrome. Women who have polycystic ovary syndromes are at increased risk of developing diabetes and heart diseases. I would say the signs and symptoms may include infertility, pelvic pain, excess hair growth on the face, chest, stomach, thumbs or toes, acne, oily skin or dandruff, baldness or by STDs. STDs are sexually transmitted diseases. It's to say that these diseases can actually be gotten from sexual intercourse with the person who is infected. Now we have other ways in which these diseases can be passed. It can be gotten through bacteria, it can be gotten through parasitic process, and it can be gotten through virus. And it's saying that this diseases gotten from bacteria and parasites can actually be treated with antibiotics or other medical treatments out there. While this disease is gotten from virus itself has no cure. Yes, it has no cure. It can only be managed by medicines out there. You can only go for treatment to manage your signs and symptoms. So, to avoid these sexual transmitted diseases, we should abstain from sex. If you cannot abstain from sex, practice safe sex. Now I'll be saying on general treatment for all these seven listed reproductive systems of the body: the endometriosis, the uterine fibroid, the gynecological cancer, HIV and AIDS, interstitial cystitis, polycystic ovary syndrome, and SID. What do we have? Like the general treatment for this whole thing is that one, we should quit smoking and inhalation of smoke. You might say, I don't smoke, I don't smoke, I don't smoke. But you consume a whole lot of smoke more than a smoker himself. You don't necessarily need to smoke before your body consumes a lot of smoke into your body system. If you live around places where they have some factories that some places where they have the airs are being pollinated with gases from their factories, or if you're staying in a place where you use firewood to cook, this also helps or endangers the body system. This is a process whereby the body inhales, the person inhales this smoke. And sometimes it shows that people that inhale smoke actually have higher risk of these diseases than people who actually smoke this. So to avoid, you should quit smoking and also avoid places where there is smoke. Avoid inhalation of smokes. The two, we should maintain a healthy lifestyle. Maintaining a healthy lifestyle simply means have a proper diet. Yes, a proper diet. Don't eat everything you see on the road. Make sure you have a healthy diet, a healthy food. It's meant it's not when you eat this in the morning, you eat carbohydrates in the morning, you eat carbohydrates in the afternoon, and you eat carbohydrates in the evening. Yes, things are difficult out there, but no matter how little it is, try to manage your health. Maintain a very healthy, proper diet. You should also go for exercises. Have healthy exercises. It's not all exercises out there you should do, so you should know the ones that are healthy. Before you engage in such exercises, it's also advised you should seek from your health medical personnel or family or community health, public or whatever health person around you there. You should go for counseling for them to know if you actually are fit for this kind of exercises. Now we should go for regular screening. Yes, regular screening. Maybe in a week you can go for 2 times or 1 time, or maybe in a month you decide to go for 1 month, every 1 month regular screening. According to your own income, you go for regular checkups, but it's advised you should go for regular checkups. Some people actually go for 6 months regular checkup. They go 2 times a year, once in 6 months, once in 6 months, and it's 2 times a year for regular checkups. It's only advised that you should make sure you always go for medical checkups. This helps in early detection of whatever illness you might experience. It mustn't always be health reproductive system diseases. You can actually have other health diseases or challenges out there which might actually be showing at an early stage, and it's easily treated and prevent a whole lot of health challenges. So, in order to avoid all these health problems tomorrow, prevention is better than cure. Yes, prevention is better than cure in the sense that you should do the needful. You know what is right, you do the things that are right, go for your treatments. If you actually have these health issues, go for medical checkups to know if you actually have these issues. Do not procrastinate. Yes, a whole lot of persons out there procrastinate. You are having some signs and symptoms of whatever it is, and instead of going to the hospital, you are procrastinating. Oh, I'll go tomorrow, I won't go. Or you assume that you're having a different illness, thereby turning yourself into a physician, treating yourself and managing yourself, which is very wrong. It said that whenever you experience any kind of signs and symptoms, you go to the hospital, you go for counseling, or you speak with one of the doctors and you go for checkups. This helps in early detection, curbing whatever it is that might arise tomorrow. So here comes the end of my lecture today. I hope you learned one or two things from my lecture today. Thank you for your support. Thank you for your comments. And please keep the comments coming in. Ask me your questions. Ask me whatever it is you want to ask me, and we'll answer these questions according to one after the other. Then bring in your comments, your ideas, your discussion. Let's have an interaction between the both of us. Let's know, bring in your ideas, the challenges, the things you actually have, or you feel you don't know how to. You don't necessarily need to type in your name and say, this is who I am, and all those stuff. You can actually just say, an anonymous person is having this and all those stuff, and we'll know how we'll handle these whole issues. Thank you for your support. I love you all. Have a nice day. Bye bye.